Life-saving.
Moi, je vois secours d'urgence.
The first thing that comes to my mind is Red Crescent.
When I think about Red Cross, I think about first aid education.
On fait des sessions de formation auprès des jeunes, que ce soit les jeunes de la Croix-Rouge libanaise, du département de jeunesse ou les jeunes de la société libanaise.
Aid, help.
Be helping people in the suffering and disaster events.
First of all, it's the HIV and AIDS, addressing impact and the vulnerability due to HIV and AIDS. And also, we are also doing something on malaria control. We are also doing something on TB and maternal care.
Help.
Help, assistance, disaster management, relief food.
Helps people.
So we are focusing more on prevention of HIV with youth. We are focusing more on youth and migrant workers, T-estate workers, prisoners. Second aspect is care and support, where we actually provide. We don't work clinically, so we provide care and support in terms of livelihood, in terms of empowerment of the PL-HIV, advocating for their rights, providing nutrition supplements. Besides what they get actually in hospitals, provide diet counseling, provide the counseling to their family members, how to cope up with this and how to adhere to the treatment.
Red Cross Red Crescent.
Red Cross is a health organization which was founded, I think, in Switzerland, if I'm not wrong. And they are helping sick people at home or with the ambulance car, and also for international things like, I think, in Haiti for the earthquake and stuff like that.
We do work with most at-risk population, gay men, men who have sex with men, transgender population, and also we have special issues in Colombia with the conflict. So we work with internal displaced people and military uniform people.
Emergency response.
I really think about caring. I really think about support. I really think about an organization that is there when you really need a helping hand. That's what I think of when I think of Red Cross.
In Southern Africa, the 10 national societies are delivering services to close 500,000 people in the form of community-based home-based care intervention, reaching out people in their household to provide them care, psychosocial support, food, hygiene article, and definitely empower the family to take care about their relatives.
Blood donation.
For me, I think Red Cross, I think paramedics, I think people running to the scene of an accident and doing charitable work.
We are working with often vulnerable children, people living with HIV/AIDS in the community, and we have also worked with we call like network of the casino workers, entertainment workers, and also we have link program with the drug user who are stay in rehabilitation center.
Hospital.
They help people who are here in distress. Maybe medical help, maybe somebody deported from other places.
We have some special project like VCT project, and we just initiate for IDU. So we go to the prisoner to have mobile VCT to the prisoner.
Helping people in problems.
The Red Cross is a body that is readily available for people who are caught up in a war situation without knowing what to do. The Red Cross is the one to get there first and to give them relief.
On the preventions, we targeted the youths and community women, and we disseminate the message in the rural community and schools.
humanitarian help and aid.
A house, right? A house of volunteers of the Red Cross who, right, that can be a very welcoming place, right, to teach people about the principles of humanity. And that is what I think is wonderful about the Red Cross as the largest volunteer movement in the world, right, that it teaches people those basic principles of humanity.
We are running for the HIV program and focus to the youth education and plan of the master's work in our border district and the capital of my country.
Okay, the Red Cross is a safe organization. It's an organization that I'm accustomed to. I know all about it.
Red Cross, well, I think in terms of emergency relief, support to refugees, and responding to any natural or unnatural human disaster anywhere.
A large number of clients who are receiving care, treatment and support on adherence. It's also been quite innovative. We've introduced issues such as we have trained social workers in the program, and we've been able to ensure that clients access social welfare grants, which makes a huge sustainable difference.
Croix Rouge, c'est la santé. Development assistance, helping the poor, and emergency.
The care for orphan and vulnerable children is looking at around 120,000 children, and to these children and their families, their guardians, we are attempting to provide an holistic package of support in the form of educational support, school fees, school materials, in the form of psychosocial support.
Relief, HIV and AIDS awareness and education.
It will help for the needy people who are in the trouble regarding health, and I expect to all the diseases. In the emergency, it helps a lot.
It's basically aimed at development of corporate workplace HIV prevention policies, programs that company employees can benefit from.
NGO, helping the poor, and I think that's it.
So the counselling and testing, and also there's our other program on HIV is solely for peer education alone.
Humanitarian assistance.
We're actually on prevention. We're focusing on the youth in and out of school. That's where we're educating the youth in terms of saying how can they prevent themselves from being infected. And we're also on treatment care and support. That's where we've got home community-based carers who are actually spread throughout the country providing home-based care. But apart from that, we're also looking at orphans and vulnerable children.
They have thousands and thousands of volunteers. They're looking after those volunteers, and I think they've tried to adapt to AIDS and what it means for them as an organization and as an employer and as a group that has a lot of volunteers around the world. And it's been a big challenge, and I'm glad to see that they're here and they're making efforts and that they're making progress, and that's what it's all about.
The main objectives of the project is to offer support to people living with HIV, orphans and vulnerable made by HIV, their primary caregivers as in the guardians, and to support the volunteers in South African Red Cross Society.
Thankfully, the Red Cross is now making it what were the beneficiaries of care into partners of care. And I think that's really important about people living with HIV, is that they're being turned into beneficiaries of care, into real partners with the Red Cross and the Red Crescent societies. And that's really wonderful.